The World Health Organization warns about a second wave of the coronavirus, voicing concerns about countries reopening too quickly. Hello, I'm Anand Naidoo, and this is The Heat. The WHO cautioned North America, Southeast Asia and Europe about scaling back on restrictions too quickly in the fight against COVID-19. There have been at least 5.5 million infections worldwide, with nearly 1.7 million of those cases in the United States. The US is now closing in on a staggering 100,000 deaths. For more, let's bring in our panel. Joining us from Miami via Skype is John Quelch. He's the Dean of the University of Miami's Herbert Business School. Here in Washington, D.C., Gavin Macgregor-Skinner is the Director of Global Biorisk Advisory Council and an infectious disease specialist. And my colleague, CGTN's Nathan King, joins us right now from the White House. Thank you, everyone, for joining us. Gavin, let me start with you. As I just said, the death toll in the United States is nearing 100,000. And the World Health Organization is warning that there could be a second wave. With all 50 states in the United States now pushing to reopen, do you think enough has been done to flatten the curve?
No, I think what we still need to focus on is being more data-driven. Again, the transmission of the SARS-CoV-2 virus that causes COVID-19 occurs at the local community, county, neighborhood level, and we just haven't been able to visualize, show that information succinctly and plainly enough to people within different communities. I've still got areas that I'm working with now that still haven't even seen this virus. It hasn't gone there yet. I've got other communities that think it's come and gone. That's not the case, because not all of us have been exposed. We're still vulnerable. So again, if we can focus more on the data and get it more down to that granular local neighborhood level, then that'll increase the idea of what is the risk. And people will realize it's not just a second wave, it's a continuation of the first wave.
Right, Gavin, but to get that kind of information that you're talking about, the states would have to carry out extensive testing, right?
Yes, they would. And again, this is where we're seeing the disparity across the US, where some neighborhoods, communities and counties have had access to the testing, others haven't, and therefore they know what the disease status is, where others have no idea whatsoever.
John Quelch, let's talk a little bit about some of the other developments. The New York Stock Exchange is now allowing traders back on the trading floor, albeit with very strict social distancing requirements. What kind of message does that send to the country?
I think it sends a message that there's a perceived trade-off between economic health and public health, which is in fact a false dichotomy, but there is so much concern about the economic damage that a continuous shutdown or constraints on economic activity are going to impose longer term on the U.S. economy that the pressure is just very substantial now. Even leaving aside the issue of the November election, I think the pressure would be, regardless, substantial to reopen the economy. And of course, many people, rightly or wrongly, perceive that they are at much lower risk than elderly people or vulnerable populations, and so they're willing to make the trade-off. If you're someone who's out of work and your savings account is going to be 100% depleted by the end of next week, and there's less than a 1% risk of you catching the virus, you're going to be willing to go out and take that risk.
Nathan, as John Quelch says, the country is under a lot of pressure to reopen. The White House is under a lot of pressure. Where is most of that pressure coming from? Is it from big business in the United States?
Well, I think it's coming from the president himself. You know, he is the cheerleader in chief for the economy, and that was the major re-election issue that he had going for him. And, you know, to see all this crashing down in the midst of essentially a COVID-19 pandemic, which made the government put the economy into a medical coma, if you like, is very frustrating for him. And he knows the electoral timetable is November. And it's funny because we were speaking to Larry Kudlow, one of his advisors today, and he said, look, we think with the 50 states partially reopening, that basically we're going to see a big rebound in the third and fourth quarter. That, of course, includes the November the 3rd election. But also, he has said, the US president, that an economy on lockdown kills more people than COVID. Essentially leading to people who have got cancer not being treated, and suicides, dependency on drugs, etc., etc., etc. And there is a point to be made for that, but of course you don't want to rush to reopen either. So what we've had is this constant fight between lives and livelihoods almost since the first stay-at-home order came in the middle of March. You remember he was asking to open the economy on April 12th, around Easter. Then he extended the stay-at-home orders. So there has been this constant push and pull, even to the point, and this is quite dramatic, where the White House came out with those three-stage guidelines, you remember, for states to reopen. And the US president was there and nodded, and then literally the next day was encouraging states to reopen, even if they hadn't met the criteria set by his own administration. And he continues that to this day.
But Nathan, there's also so much dissonance within the administration itself. The White House National Security Advisor, Robert O'Brien, he says it's going to be face masks that will get the economy reopened. But as we are all aware, the president himself doesn't follow that advice.
No, he doesn't. Well, at least not in public. I've got my mask here, and I can tell you when I'm off air, I'm wearing it. And that's quite true of a lot of White House officials now, especially when a close aide to the president got COVID-19, and also Mike Pence, the vice president's press secretary. But there was a photo last week, Thursday, of the US president wearing a mask in Ypsilanti, Michigan at the Ford plant, which makes cars but also ventilators now. And he was asked to wear a mask. He didn't for a lot of the on-camera portions. In fact, Michigan said you're breaking the law because we require it in car plants. But he has said in the podium at the briefing room behind me, I advise you to wear a mask, but I'm not going to wear one. And he sort of said, I can't see myself behind the Resolute desk wearing one. I've got to meet world leaders, he said. And essentially it comes down to him not feeling very masculine wearing one, I think. In fact, this is sort of borne out in the last 24 hours. Joe Biden, as you know, his Democratic rival for the November election, wore a mask on Memorial Day, visiting a memorial in Delaware. A Fox News personality tweeted out, this is a reason not to vote for Joe Biden, and the president sort of retweeted it. It's sort of masks versus masculinity at the moment, which is not a great example to set as people are going back to work. I think I look better. I think I look better with mine, but.
No comment, Nathan. Gavin, let me get back to you. The World Health Organization has stopped trials on the anti-malaria drug hydroxychloroquine. That's after the British medical journal Lancet reported that, or published a study showing that there was a lower survival rate. What can you tell us about this WHO decision?
Now, this is very important because, again, there's still a lot of gaps in our knowledge, but also a lot of questions in our research portfolio that we need to be sort of actually following and trying to get those answers and doing more research. And again, when statements were made about drugs like hydroxychloroquine, again, having lived in Africa for many years and worked in malaria areas, I know what chloroquine toxicity looks like in people. So I was very skeptical. But again, we need to be more evidence-based. So again, there's still lots of questions out there about the medications, about the drugs, the potential of a vaccine, but also how active or how this virus stays on different surfaces or even on your hands. It was, as we tell everyone to keep washing their hands regularly, how long does this virus stay on your hands? And is it possible to cause infection over how many hours, minutes, or whatever it may be? So again, I'm encouraged by what WHO has done because they've gone through, they've used what we term evidence-based public health or evidence-based medicine, and they've come up and said, here's the research we did, now we've got an answer, it has to stop.
Gavin, so absent a vaccine, well, for at least the next few months, possibly until the end of the year, where are we in terms of what treatments can be used right now?
That's a good question, and again, being a new or novel virus, with none of us having an immune system or antibodies that could that were there primed to fight off the infection, this was all new to us. So again, a lot of the care that's been done for patients in hospitals has been supportive care. As you've seen, the oxygen that's been required for many of these patients that have had severe pneumonia and difficulty breathing. There's a number of treatments out there now that have shown, again, some positive conditions and signs and symptoms, or actually shown that to be effective. Now, again, what we need to do with so many people here in the US and also globally, the need for doing more evidence-based medical research based on the available medications we have, based on other therapies, other supportive treatment we have, it really should be the top of our agenda right now. And I don't actually see that happening because the funding's not there, and also the will to get those answers is not fast enough.
John, there's a senior White House economic advisor, Kevin Hassett, who is saying that the unemployment rate in the United States could go up to 23% and will, in fact, even go higher in June. I was wondering what you make of that, and when can we expect to see a turnaround in those numbers when they actually start coming down?
Well, first of all, I would agree with that forecast, because there is a large number of organizations and corporations in the U.S. that have been doing their best to retain personnel, retain their people, and not put them on furloughs and not lay them off. But I think that time is running out for those organizations, and I would expect to see a substantial number of incremental unemployment applications coming in the month of May, as well as early in June, the first half of June. Now, it may be the case that as the economy opens back up, there may be opportunities for a significant minority of those who have been laid off to go back to work. But I would not overestimate the speed with which that's going to happen, because, you know, workers and consumers have to be willing to take the risk of engaging with each other, going back to factories, going into retail stores, in order to get that economy rolling again. And we saw the other day in a Ford plant how it had been reopened and then was shortly forced to close down again when cases were discovered. Similarly, in many retail environments, you got restaurants which might open at 50% capacity with a proportionately smaller number of wait staff. But at 50% capacity, many restaurants simply cannot operate economically and remain in business. So there are many constraints on the speed with which workers, entrepreneurs, and consumers can actually get back into economic activity as we knew it pre-COVID. So I would not expect this very rapid bounce back that is being widely forecast, and which the stock market in the U.S. Seems to be anticipating.
Nathan, President Trump, of course, was banking on the economy, paving the way for his re-election. But now that the economy is tanking in the way it is, we see these unemployment numbers. How is he retooling his campaign?
Well, at the moment, there's not a lot of tools available. And I think what the White House here wants to see is a bottoming out of the economic. I mean, we all want to see this, but what they're banking on is the economy reaching some sort of bottom this month, essentially, and then a dramatic rebound. You know, growth rates of 10, 15%, which of course is from a very low base, but something you can take to your electorate and say, hey, the biggest growth we've seen since, you know, the 1930s or since the Second World War, something like that, even though, of course, it's after a severe contraction. There's also another way that the US president is going to sort of rally his base, at least, and that unfortunately is how a lot of political campaigns are run these days, and that's going negative. You've seen it with the battle with the governors over different pieces of equipment. You know, it's our stockpile versus your stockpile. You didn't prepare properly. You can't have ventilators, you can. Calling out governors that tend to come from Democratic states, and especially pointing the finger at ones that come from Democratic governor-run swing states, like I'm thinking of Michigan, essentially, but we're looking at North Carolina too, with the threat to pull the convention from there. So that is another strategy, and of course, the elephant in the room, or maybe we should say the dragon, is of course China. and you have seen a ratcheting up and a ratcheting down and a ratcheting up again of essentially finger pointing towards China, both on the origins of the virus, but also in terms of some sort of feeling that China somehow is now too powerful in multilateral institutions like the United Nations, WHO, and there's continuing pressure for more trade restrictions, more tech restrictions, and they feel they may have a window of opportunity because of the potential origins of COVID-19. Blame China.
Right, Gavin, I've got about a minute left, and I want to talk about the fight against coronavirus. There are now something like 120 vaccines which are in development around the world, and some of those vaccines are actually in human trials already. Do you think we could have a vaccine before the end of the year?
I think we will. I'd like to see more pooling of resources. There's a lot of smart people out there, a lot of labs with capabilities. To have so many vaccines on the table is probably not the best use of our resources at the moment. We need to be pooling those resources in multiple countries, multiple laboratories, multiple scientists to work together and use that collective knowledge to produce a vaccine or a few vaccines that we can then go to scale and manufacture quickly, and then start to use them on the high-risk, vulnerable populations and start to see them go to scale, hopefully by the end of the year, if not early into 2021.
Okay, thanks to all our panelists. South Africa will start to reopen its economy next week after a 2-month lockdown. The country of 57 million people reports nearly 24,000 cases and close to 500 deaths, and officials warn it could get worse. I spoke with Ebrahim Rasool, the former South African ambassador to the United States, and CGTN's Angelo Coppola about the situation there. Angelo Coppola and Ambassador Ebrahim Rasool, thanks so much for joining us.
My pleasure.
Angelo, let me start with you. The South African President, Cyril Ramaphosa, he has addressed the nation. He did that over the weekend. He said that certain restrictions would be lifted on June 1st, but at the same time, he warned that the country could see a peak in coronavirus infections in July. But looking at those restrictions that will be lifted on June 1st, what does that mean in practical terms for South Africans?
Well, look, the bottom line is we move now down to level 3 from level 4. So almost everything is going to be open. The retail sector is opening and reopening, including all the malls, of course, but the bars and restaurants for sit-down meals are closed. There's no on-site alcohol that's allowed to be consumed there. In terms of the schools, well, that's been one of the more contentious issues. And that links back to this whole Gini coefficient issue that we have. And that's a huge gap between the rich and the poor in South Africa. Many of the kids who want to go back to school can't afford to stay at home because they can't afford the bandwidth, and they also don't have the devices that they need to do any homeschooling from, or places to do the homeschooling from as well. So they can't work from that home that they're living in at the moment. And the kids who can afford devices and bandwidth have that choice. The government, of course, has taken a phased-in approach here. So there are just 2 grades that are going to be going back to school on 1 June. That's the last grade in junior school, and then the last grade just before going into university. They go back on the 1st of June. Big issues, of course, are going to be about scanning and testing the kids when they come back next week. Desks in classrooms have to be removed and moved around. And of course, in the public school sector, we have a major issue because some of the classes can go between 40 and even sometimes 50 people per, or kids per school.
Ambassador Rasool, President Ramaphosa has been praised for his very quick action in imposing that lockdown in South Africa. But right now he's facing a lot of protests, he's facing a lot of criticism as the economic impact of the coronavirus has deepened in South Africa. In fact, the main opposition party in the South African Parliament, the Democratic Alliance, says the president is acting 6 weeks too late and irreparable damage has been done to the South African economy. So I'm wondering, what kind of a balancing act is the president involved in now? On the one hand, trying to protect South Africans and their health, on the other, trying to protect the economy.
I think when the president intervened initially in the coronavirus COVID-19 crisis, there was universal praise for the decisiveness, the strength that he showed, and the science-led approach that he displayed. I think that he followed up the lockdown with a stimulus package for both the economy and a safety net for those who are on the very poor side of the Gini coefficient, and that also elicited quite a lot of praise. It's clear that as this lockdown continues and as the virus continues to ravage our society, that chinks in our armor will emerge. I think, however, that the Democratic Alliance has experimented with notions of herd immunity. The province and the city that they govern is by far the epicenter of the crisis, with 70% of the deaths in the Western Cape. And so I think that's not the real debate. The real debate is often within the alliance. I think that's where people are trying to balance lives versus livelihoods. I think there is a phased approach towards unshackling the economy. But at the end of the day, within the ANC itself, I think those who are on the sides of lives are winning the debate. And maybe that's the undue caution. I think the issue of school opening, that's a major issue of contention that I think is there. And that's not necessarily between parties. It's within parties and within society. And certainly, I think what the president must also balance out is at what point does the social cohesion in our society give way to greater prospects of civil unrest and looting and those kind of things as hunger begins to strike home.
Angelo, there are health experts in South Africa who are predicting that up to 40,000 South Africans could die from COVID-19 by the end of this year. And as I mentioned, that peak could be coming in July, which is a month away. What are the basis for these projections?
Well, we've been having conversations with the convener of that modelling consortium, as it's called. And this consortium has been providing the data, the models to the national, to the council that looks after the government's response to the pandemic. And he was saying that because the virus is so new, there's so little known about it, because we only have had any kind of evidence of it since November last year, that the data that's coming in, it changes all the time and it changes the modelings. And you can see that in the difference between the pessimistic and the optimistic view in terms of the number of deaths by the end of November. So it ranges between 40-odd thousand and 48,000 by then. So he's saying that as more data comes in, so the models will get updated, and that data gets shared, and the models get shared with that grouping of ministers that's looking after our response to the virus. And it's then up to the ministers to decide whether to take on that information or not, and to take sort of informed decisions about whether they actually are going to use the science, as the ambassador was talking about, to inform their decisions. So there is another debate that's also happened on the sidelines, in fact, and that was around whether these models should be shared with the public. And there was some anxiety in government that perhaps the information shouldn't be shared because it might scare off some of the public. But on the other hand, it seems like sanity prevailed, and that information, those models, will be shared with the public so they can make informed decisions. Anand?
Ambassador, as many countries have discovered around the world, it's very difficult to impose a one-size-fits-all plan to counter the spread of the virus. Cape Town, where you are right now, as you've just pointed out, is one of the hotspots in South Africa. Is Cape Town going to lift the restrictions in the same way that other parts of South Africa are going to?
I think in reality, what the president has announced, without calling it what I'm going to call it, is that the country will shift to level 3. But places like Cape Town will effectively be at level 3.5, meaning that we will open up for economic activity, but there will be additional contextual restrictions placed on different hotspots across the country. And I suspect that Cape Town being at level 3.5, we will probably begin to get the bulk of the security personnel, the army and the police, to patrol our social distancing, to patrol our movements and all of those kind of things, which I think is right. I think we will probably have to ensure that our factories are better sanitized and our workers are always masked as we go forward. And so I think Cape Town will feel a level 3.5, and I think it's in the best interest, with the prospect of returning to level 4 if the infections continue to be a runaway. The reason that I think Cape Town is getting the benefit of the doubt is because more tests reveal more infections, and maybe Cape Town is slightly ahead of anticipating that second wave of infections. And so giving that benefit of the doubt, we have the prospect of a fallback from level 3.5.
Angelo, South Africa imposed some pretty strict lockdown conditions when it was first imposed, confining most people to their homes. I'm wondering what kind of compliance has there been in South Africa, especially in high population density areas like the inner city areas in Johannesburg, for instance, or even the townships which are around the cities?
Well, we've spent a fair amount of time in those townships, those informal settlements, those squatter camps, the inner city of Johannesburg, Hillbrow, Yeoville, and compliance after week 4 was almost non-existent. People couldn't stay in their apartments when you're sleeping between 5 and 10 people per room. And so they were drifting onto the streets, either looking for food or buying food or standing in queues to go to the supermarkets. There was lots of social distancing in the initial stages, but we were back in town just a couple of days ago, and it's business as usual in the CBD, downtown Johannesburg area. And so in terms of compliance, we understand from the police minister that some 230,000 people have been arrested for contravening the regulations related to level 5 and level 4. That's 230,000 people arrested and charged. Some have paid admission of guilt fines, but the police and the army can't go around arresting everybody. If you notice what's happening in downtown Johannesburg, for example, there wouldn't be enough place in the jails for that to happen, or for the courts to deal with those cases. So compliance seems to have drifted downwards the longer we've gone into this lockdown phase. Anand?
Ambassador, I've only got a minute left, but even before this pandemic, South Africa's unemployment rate stood at a staggering 29%, and now we're seeing long lines of people outside food banks. What is the government doing to address this kind of food insecurity in South Africa?
I think that on the one hand, there's the safety net that is being put in place. I think that we have lofty ideals. We've raised 500 billion for it, of which only about 137 billion rands were borrowed. The others reprioritized from within the budget. So I think certainly the intentions are good. The mechanisms have often failed us. For example, the 350 rand per unemployed person who qualifies has not been a great success, and that's caused anxiety amongst people. And I think the idea, therefore, of admitting 8 million new workers to allow them to go to their work is one way of ensuring that they don't do job losses, and that there is income in the families rather than waiting for our systems to come together. And that, I think, is what level 3 is mostly about. 8 million people returning to work, right, as opposed to only the 1.5 million on the 1st of May.
Okay, that's where we have to leave it. Ambassador Ebrahim Rasool, Angelo Coppola, thanks to both of you for being with us. And that's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.